don't intend to try to match the eloquence of Senator Warnock, and I'm certainly not going to repeat what he just said. Raphael and I have introduced, as he said, the Affordable Insulin Act of 2023. It would cap the price of insulin for people with private insurance and people who don't have any insurance at all at $35 for a 30-day supply. I've noticed that nobody in Washington ever stands up and says, I've got a lousy idea and I need money for it. It's always, I've got an extraordinary idea and an important idea and an effective idea, and we need to do this. We need to spend money on it. And in almost all the cases, the people making that assertion are in good faith. They really believe that. And in many cases, it's true. They have a great idea. And a lot of what we do, as you know, Mr. President, is we make decisions, but that means we balance interests. We've got a finite amount of money. We can't keep borrowing at the rate we've been borrowing. We've got a finite amount of money, and we've got to make hard decisions on what to spend that money on. And the traditional dichotomy is, well, guns versus butter. Domestic needs versus defense needs. But it's more complicated than that. Sometimes it's butter versus butter. And those are hard decisions to make, and I realize that. The second point I guess I would make is that we deal with so many problems, Mr. President, in the United States Congress that, frankly, we don't know how to solve. We're doing the best that we can, but we're really nibbling around the edges. I don't know how to make a parent love their child. We all know that if a parent doesn't show the parent's love for a child, the child is not going to stop loving the parent. The child is going to stop loving himself. And we know what that leads to. And I don't know how. I don't know anybody that really knows how to make a parent love a child and support their children. That's one of those problems we'll deal with all the time. It's hard to solve. We don't really completely understand how to successfully help an addict stop being an addict. I wish we did, and there are things we can do to help the addict, but we don't really have the answer. Sometimes we pretend we do, but we don't. We don't have the answer. I don't have the answer to stop people from hurting other people, from taking their stuff and doing it repeatedly. And I could continue. All the easy problems are solved. And I make these 2 points, that we have a lot of competing interests for the way we spend money. And the point that there's some problems we really don't know how to solve. To assert, and you can believe me or not believe me, but if you'll read the report that Raphael talked about, you'll see that he and I believe, are correct. This is a problem we can solve. if I had to pick one health problem that affects the quality of life and costs our country and our system the most money, it would be diabetes. I don't know if you've ever known somebody with diabetes. It is a horrible disease. And it can't be cured, but we know how to treat it. It's very pervasive. In my state, 44% of my people are affected by diabetes directly. 14% are diabetic. Another 30% are pre-diabetic. And Louisiana is not the only state with those kind of numbers. Diabetics account for $1 of every $4 spent. One out of every $4 spent on health care in the United States of America. Think about that. The average cost of hospitalization for a diabetic, which if they can't pay for it, ultimately we all pay. The average cost of hospitalization for diabetic patients is from $8,400 to $23,000 a year. And medical costs, if you look beyond the quality of life issue and the moral issue of just helping people who are sick, if you look at it in terms of dollars and cents, diabetes costs America $327 billion a year. That's in medical costs and lost work and wages and lost productivity. So we know the problem and we know the costs. And we have a solution. Insulin. It works. It works. So why don't we make insulin available to everybody who needs it, whether they can afford it or not? And that's what our bill does. It's not going to be free. Insulin doesn't cost that much to make, and I don't begrudge the companies who sell insulin. I don't begrudge them making a profit. But it is bone deep, down to the marrow, stupid for us to allow someone whose diabetes can be managed by taking insulin, not to take that insulin because they can't afford it. That's immoral, and that makes no sense in terms of dollars and cents cost to the rest of the American people. And Raphael and I's bill would address that. It would say, if you have private insurance, great. But if you don't have any insurance at all, if you're uninsured, and a lot of Americans become uninsured every year. Maybe they don't stay uninsured, but they become uninsured. And you're diabetic, we're going to cap your out-of-pocket costs at $35 for a 30-day supply. So you have no excuse not to save your to take your insulin to address your diabetes. It's the right thing to do. It's the smart thing to do. And Raphael and I's bill is paid for. We're not suggesting we go out and just borrow more money. This bill, our bill, is paid for. It's going to be paid for by finding other monies in the budget. Now, Senator Warnock has worked extremely hard he's the lead author on this bill, and I thank him for his big mind and his good heart and soul on this issue. Others have worked hard too. Senator Collins and Senator Shaheen have a bill. And we're working to try to marry all of our two bills, the four of us. But ultimately, what it's going to come down to, in my opinion, is that senators being senators, Senator Schumer is the floor leader. He's going to have to force a shotgun marriage here. He's going to have to take the good work of Senator Shaheen and Senator Collins and Senator Raphael and my work, whether you want to call it good or not, and say, I'm going to take their efforts and put them in one bill. And Senator Schumer's bill will be paid for. Otherwise, I'm not going to vote for it. But it will be paid for. And his bill...
Roger really needs to speak quickly.
And I'll wrap it up real fast. And his bill will be paid for, and it will lower the cost of insulin for insured and uninsured. With that, Mr. President, I yield to the senator from Kansas.